greetings for the day. I'm Sayukta from Beautiful Spotless Skin team and wish you all a very happy good afternoon. So today we are doing this Insta Live and we are going to delve into a topic which is really close to all our hearts. It's a chronic skin condition called acne, and most of us, we have gone through that phase of acne vulgaris. As women, we know how crucial it is to deal with acne and acne related issues. So today we are here to talk about acne and acne management with an expert. So our skin expert of this very conversation is going to be Dr. Priyanka Jaju, and she is an upcoming and dynamic dermatologist based in Ghaziabad. She is a consultant dermatologist and cosmetologist at Leelavati Skin and Laser Center in both Delhi and Ghaziabad. Dr. Jaju completed her MD from S&M College and Research Center, and following her passion for aesthetic dermatology, she pursued a one-year fellowship at the Tutors Academy of Cutaneous Sciences affiliated with RGUHS, Bangalore. With an active role in the dermatology community, Dr. Jaju has been a faculty member at numerous national conferences and has several publications in national and international journals covering topics in clinical dermatology, dermatoscopy, and aesthetic dermatology. And currently, she serves as a reviver for the Clinical Dermatology Review, the official publication of IADVL. So today we are going to be joined by Dr. Priyanka Jaju shortly, and the topic that we are going to delve into is acne management. Now, as I said, acne is such a common chronic skin condition. Most of us has gone through that phase and it becomes so irritated. I often say that acne is just not related with the surface or, with appearance. Deep down, it do affects our, mental health as well. And many times people with chronic acne issues go into depression because it's such a, tiring thing, because even if acne eventually will go out, it can lead to other breakouts or the scars or inflammatory post-acne marks. They are so difficult to deal with. So it's equally important to understand how to prevent having those, post-acne inflammatory marks or scars, those pits, big pits. Even in acne, they are of various sizes and grades. Initially, they look like very small bumps. Then they become painful, have this pus. At later stage, it becomes so painful because they are really big, like a big cyst under our skin. And it's equally important to diagnose the root cause. It's important to understand why acne is happening to us. And we all are different. We all have different skin conditions, different types of skins, and different environments, etc., etc. So we need an individualistic approach to manage these acne. So again, it becomes very important to understand that, home remedies, over-the-counter topical applications, or what our parlor wali auntie is telling us to do, or probably what our friend and relative have done, they many a times will hand us over the prescription that they went through. It's not a good idea. It can damage and be really harmful for our skin. So if you want to reduce the time of the treatment for acne, have a flawless skin even after acne, you don't want those scars, even if scars are there, you want to manage them, please go and consult the right person at the right time, as early as what you need to look for. A qualified, board certified dermatologist who has done MBBS and MD in dermatology, venerology, and leprosy. So you can actually go for these certifications, because doctors normally have these certificates on their walls of their clinic or hospital. So today the topic of discussion is acne management. In case you also have some doubts or something you want to ask the expert, please feel free to post your questions in the comment section during our conversation. During this Insta Live, we will try to answer those questions also. We will take up those questions with our expert and we'll try to get a proper solution. So with acne, it's equally important to understand what to do and more important to know what not to do. Now it becomes so difficult for a person who's having these acne to keep the fingers or hands away from the acne. So we'll try to discuss that as well. And now we have with us Dr. Priyanka Jaju. A very warm welcome to you, Doctor.
Hi, thank you. Thank you for having me on your platform. And
It's such a pleasure, Doctor, to have you with us, and more importantly, because we are going to talk about such an important topic. I always say acne management is so close to our hearts because most of us has gone through that phase, and it's such a chronic and common skin condition. So it becomes even more important to understand how to deal with it. To start with, Doctor, what is acne? Why is this formed?
yeah, so right now I see like everyone right from puberty till your 30s, 40s, everyone is like, abhi bhi dane nikal rahe hain, abhi bhi I'm getting acne. What is the reason I'm getting acne? So for that, I think first you should understand what is acne actually, like what is pimple. So basically, this happens when your hair follicles becomes clogged with oil. So, whenever your hair follicles are clogged, it can lead to pimples, blackheads, whiteheads, whatever we call them in our common language. And then there are different types of acne. So, the first one is comedones, so blackheads, whiteheads, the thing which we call
Right.
blackheads, and the basic one. Then there are papules, pustules, nodules, cysts. So, depending on the grade of acne and the severity and the type of acne, we treat it accordingly. Yeah, but basically, it's your when your hair follicles becomes clogged with oil, so that causes acne.
Mhm. And we often see that oily skin people complain that we are so prone to have acne. Do only oily skin people get acne, or otherwise even dry
Everyone,
combination? Every skin type is equally at risk.
yes, yes, definitely.
Uh,
Anyone and everyone, even dry skin can lead to a lot of irritation and inflammation. That can also extreme dryness, extreme oiliness, both the extremes can cause acne. Yeah.
Right, so it's important to maintain the balance, which is a very difficult thing. Now, doctor, we often get to hear that keeping a good skincare routine is important because it can make your good skin barrier that can fight with acne, etc. Now, the problem is that when we talk about skincare, we understand that we need to be more consistent with it. हम रेगुलरली उसको कर पाए लेकिन आजकल मार्केट में 10 स्टेप स्किन केयर रेजिमे कोरियन स्किन केयर रेजिमे देयर सो मच ट्रेंडिंग एंड वी आर सो कंफ्यूज कि ऐसा लगता है बस हम ही नहीं फॉलो कर पा रहे बाकी दुनिया पूरी जो है वो ये 10 स्टेप स्किन केयर रूटीन फॉलो कर रही होगी सो व्हाट माय क्वेश्चन टू यू इज दैट हाउ वी कैन कीप इट minimalistic. Please tell us about a basic skincare regimen that can also help us in preventing acne or dealing with acne.
Yeah, so I think the more complicated you make it, the more difficult it's going to be consistent. And consistency is the key in maintaining your skin. Like consistency, and I feel simplicity. Jitna
Mhm.
simple, the more results and the more better it is for your skin to, Otherwise, it will be like back to back. You're applying so many things, and you don't know what is
Mhm.
working. If there is any reaction, you don't know what is giving the reaction. You cannot make out because there are 10 things you have applied. So I think the more simpler and the more consistent you are, the more better results it is going to be, and the more efficacious it's going to be. So basically, I feel in the morning a basic sunscreen definitely for acne-prone skin, especially it should be non-allergic or hypoallergic. You can check for these tags which is written on the sunscreen. Non-allergic sunscreen, something which doesn't clog your pores, something which is water resistant, and mineral sunscreens are more effective and more better. Anything which contains zinc or titanium, you can check for that more than chemical sunscreen for sensitive skin and acne-prone skin. And if you have a dry skin, you can apply a moisturizer before the sunscreen. So moisturizer again, it should be very light in weight, not thick moisturizer, and something which again is going not it should be not allergic, like not too many composition. A basic moisturizer, simple lotion based moisturizer or any gel based moisturizer for your skin that works. Extremely dry skin, moisturizer morning and night. Normal skin, just sunscreen in the morning, moisturizer in the night, followed by the actives, depending on the condition of your skin. any active serum you can apply in the night. I think that should be more than enough for your skincare routine. Nothing more.
Right.
Yeah.
But those actives should something that your doctor has prescribed you, or you
Yes.
can take it, over the counter,
That's
because people are falling for it. Again, market is flooded with such products, and
correct.
people are by themselves going and buying so many actives, applying it, etc., etc. So,
Correct. Correct.
what's your advice on that, doctor?
Correct. Correct. Uh,
Right. So,
yeah.
yeah, so we need to go and consult a doctor before we go for these actives or treatments, right?
Definitely. Definitely.
Okay. ना डॉक्टर बहुत सारी चीजें हैं जो लोगों को लगता है, कई बार स्पेशली जिनकी ऑयली स्किन होती है उनको लगता है कि उनके चेहरे पे बहुत ऑयल है, बहुत डर्ट accumulate हो रहा है, probably that is the reason they are having acne, and they keep on cleansing their face again and again with a face wash or something जिससे बहुत झाग हो, उनको लगता है यही एक अच्छा फेस वॉश है, क्लेंजर है. So क्या होना चाहिए exactly?
Yeah, so like I told, कोई भी चीज एक्सट्रीम में it is harmful for your skin. People start scrubbing your skin, picking on your
Hmm.
acne, trying to clean the dirt which is there inside. So that can lead to pigmentation, that can lead to more scarring, which is more damaging your skin. Like, so I feel excessive cleansing again might lead to dryness of the skin. Again, dried skin very easily it gets inflamed. So excessive cleansing is not recommended. At least if you're like working out or going out continuously or exercising, 2 to 3 times a day should be more than enough. Otherwise, normal morning and night should be enough. And coming to your face wash, people with oily skin can use a foaming face wash, and those who have dry and sensitive skin, they can go for cleansers. So I see everyone using cleansers these days. Like everyone feels that we are maintaining our skin by using cleansers. But no, cleanser is not for everyone. If you really have sensitive skin or dry skin or your skin is damaged because of using excessive products, in that situation, cleanser helps. Otherwise, your foaming face wash, anything which contains salicylic acid should be enough, more than enough.
Fair enough. And again, with moisturizer, people feel that, I'm already secreting so much of sebum oil. Why do I need a moisturizer? And probably that is the reason many times people with oily skin that, they just omit that part. They
Mm-hmm.
don't moisturize their skin.
Correct.
So, what's the right
Yeah.
way of it?
So, yes, natural oil definitely works. People with oily skin might not need such repeated application of moisturizers as those with dry skin. Those with dry
Hmm.
skin, we are like apply 2 to 3 times a day, or whenever you come home, you just splash water in your face and apply moisturizer. People with oily skin, you need a moisturizer because one, it acts as a barrier repair. It repairs your skin. Moisturizer is not just, it doesn't have the only thing of moisturizer is not just moisturizing. It also acts as a barrier repair. It cleans your damaged skin. And second thing, if you're consulting a dermatologist, they might give you a few things so which cannot be directly applied on your face. In that case, it comes as a base cream. You can apply it as a base, moisturizer as a base, and then apply your actives. So that way your skin doesn't get damaged easily. Especially acne prone people, your skin won't get damaged if you, apply a moisturizer.
So choose right kinds of moisturizer as per your skin type, as per your skin condition, and in case of doubt, you can always go consult with your dermat, and they'll help you in choosing the right product. Now, doctor, with sunscreens again in India, most of us use sunscreen only when we are going out, stepping under the sun. Otherwise, once in a day, maybe probably we feel it's more than enough. Quantity also we don't consider much. Peanut size sunscreens also go for many people. It's okay. Amount is sufficient. So again, especially to take care of a acne-prone skin or part, because treatment portions also involve sunscreens in acne management. So, what kind of sunscreen we should go for? How often we need to reapply? How much to apply it?
Yeah, how much to apply is a very big question these days. So, what kind of sunscreen, like I've mentioned, more of hypoallergic or non-irritant sunscreen, not very heavy sunscreen, something which is lotion based or water based should work. More preferably, mineral based sunscreen like zinc or titanium, the sunscreens which are purely mineral based sunscreen. Sorry, for acne prone people. And yeah, how many times to apply? Ideally, it works for 2 to 3 hours. Sunscreen, once you apply it, has its efficacy for 3 hours. You are supposed to reapply it, but not always possible. So you can apply it in the morning and afternoon. That should be enough. If possible, 3 times a day. If you have pigmentation on your face, then 3 times a day. And um, yeah, sunscreen. I think half an hour. If you're applying a mixed sunscreen, something which contains chemical and physical sunscreen, half an hour before going out, you should apply. It takes half an hour for it to get activated. And if you're applying a physical sunscreen, like a mineral sunscreen, you can just apply it before going out. Like directly, you can go out in the sun before, like apply it and go out. And the third thing is there's something called blue light, something which has come up recently in the past few years. So that is something because of your excessive desktop use or mobile phones, your LED lights, everything can cause pigmentation, post acne pigmentation. So we recommend sunscreen to be used indoors and outdoors nowadays. And even if you're indoors, you might go out for a small walk and go out to your door or your gate. So in that case, your skin becomes damaged. So yes, sunscreen indoors and outdoors. Yes, and mineral-based sunscreen more preferably.
Right.
I'm so sorry.
There is this one question which is grabbing my attention, and the question is: can regular facials help prevent acne? A viewer has asked this question, and with this, I would like to discuss about it. It's again a very common practice of our society. हमें डॉक्टर से ज्यादा पार्लर वाली आंटी पे भरोसा होता है बिकॉज वी आर क्वाइट फ्रीक्वेंट टू देम महीने में 1-2 बार हम जाते हैं और पार्लर वाली आंटी ने अगर बोल दिया अरे तुमको पिंपल हो रहा है मेरे पास एक फेशियल इससे नहीं होगा या माइक्रोनीडलिंग फीलिंग ये सब फैसिलिटीज भी सलून में मिलने लगता है सो ये कितना practical है doctor to go to parlors and get facials done to help dealing with acne or do they really work or they could be harmful for us?
See, regular facials is the main problem is they do not know when to customize the thing. So if you're having your acne or sensitive skin, like I've told earlier, no excessive washing, no scrubbing, no picking on your acne. But that is what they do. Cleaning के नाम पे you're scrubbing your face, which leads to more irritation, more breakouts. You're picking on your acne, trying to remove all the dirt. It can lead to scarring in the future, more pigmentation and scarring again, which is very difficult to revert back. So, and then the thing is, like I've told, more of irritation and more of damage to the skin rather than if your skin is normal and you don't have any issues, you can definitely go. But if you're having any issues, I think better to avoid it till your skin becomes normal.
Right. Another very common practice that we normally do is to go for home remedies. और जब acne होता है तो आजकल तो toothpaste, garlic, lemon juice, we end up applying everything and anything on our skin in the name of home remedy. Do these home remedies, DIYs, they have any effect or they can also impact them in a negative way?
See, there's no proven fact. Whatever home remedies we have that has been passed on by our grandmothers and nani, dadi, sunawa, it's been passing on. So there's no proven fact as such. As long as it's not anything harmful, which is burning your skin or damaging your skin, you can apply it like purely for your psychological purpose or whatever the effect is. It might be a little minimal. Like it might take more time 2 महीने की जगह 6 महीने if you keep applying the same thing again and again might work, but yeah, it takes more time and there's no proven thing if it actually works. And if it does work, you actually you do not know what things work. Like are you supposed to apply milk or curd? हमें नहीं पता. What is trial and error? We are just applying whatever we feel. So yeah, there's no proper way. अगर है भी if it works, we do not know the proper way कि क्या लगाना है क्या लगाना है. And like I told, whatever the effect is might be minimal, not
एंड एक और चीज जो हम करते हैं नॉर्मली एक्ने आने पे वो है टू गो टू अ नियर बाय केमिस्ट शॉप गेट अ ओवर द काउंटर टॉपिकल एप्लीकेशन एंड वी लव दैट क्रीम यू नो हमें लगता है कि हमने एक तो डॉक्टर की कंसल्टेशन फीस बचा ली दूसरा टाइम बचा लिया सिर्फ पास में गए लेकर आ गए एंड इनिशियली दोस क्रीम्स आल्सो दोस ट्यूब्स आल्सो वर्क लाइक वंडर तो हमें लगता है हमारे हाथ में कोई मैजिक क्रीम लग गया है बट then later on we realize we are our skin is now so addicted to it और दूसरे बहुत सारे problems होते हैं उस पे we would like you to shed some light doctor because it's a very common problem
Yeah, I'll tell you the all the chemists, like at least in the metro cities and any tier one, tier two, everyone they have this common cream which they give it as a skin cream for any and everything. Like for your acne also it will be the same cream, for your skin rash also same cream, for fungus also same cream. So it is not possible, and that those commonly contain steroids. So it is not possible that one thing is going to work for everything. And steroid, unless your doctor is prescribing it, I do not recommend that you use it on your own. Most people they just know that they name steroid, but they do not know कि steroid के अंदर आता क्या क्या है. What things do come under steroid. So over long term it causes more damage than actually being helpful. Steroid on your face, it can lead to more facial hair, it can lead to thinning of your facial skin. Even like I get patients ke threading karane mein bhi I get cuts, my skin has become so damaged, it's become so red, I cannot go out in the sun, it starts burning. And long term steroid use, yes, you just take one cream for everything. So or sometimes we prescribe it to one of the relatives and the other person starts using it in the house. Ki like mere paas aadhi hai. So it yeah, doesn't work. I think, I'm not
So
audible.
most of the time ये भी होता है कि जब आप किसी से पूछो कि आप डॉक्टर के पास क्यों नहीं जा रहे हो whether you have acne issues and they will say कि doctors chemicals देंगे या steroids देंगे and what we are doing we are ending up doing the same at least doctor in case देंगे भी तो they know how to taper it down how to discontinue it which won't cause any damage लेकिन ओवर द काउंटर जब हम लेते हैं तो वो हमें डैमेज नहीं करता है तो ओवर द काउंटर टॉपिकल एप्लीकेशन मेडिकेशन इज अ बिग नो नो start respecting your skin that is really important. I'm also getting questions asking कि क्या चॉकलेट खाने से एक्ने होता है और ये बहुत सारे क्वेश्चंस होते हैं डॉक्टर क्या मीठा खाने से एक्ने होता है डेयरी प्रोडक्ट से एक्ने होता है क्या खाएं क्या नहीं खाएं एनी डाइटरी प्रिकॉशन दैट यू वुड लाइक टू रिकमेंड
Yeah, they've proven facts actually. Not especially chocolates, but anything which is refined. अब जो chocolates market में आते हैं, it's not like pure dark chocolate. It contains sugars and it contains a lot of oils and everything. So anything which is refined, anything which is processed food, refined food, or any dairy product, these can lead to hormonal disbalance, and these can lead to acne. These can shoot up your insulin levels, so that can lead to acne. So definitely avoid that. Any food which has low glycemic index, your nuts, your omega-3 fatty acid containing foods, so these are better. Yes, definitely. So processed food, avoid in acne, especially when you are having active acne. More of antioxidants, more of omega-3 fatty acids. These work.
Okay. So eat well, have a good lifestyle, rest well, sleep well, exercise well. That also we go along
Yeah.
in maintaining a good skin.
Yes.
Now, doctor, when a patient comes to you with acne, are there any tests that you normally recommend them for diagnosis?
Yeah, depending on the type of acne, we actually can make out what can be the reason behind the acne. Acne all over the face is not the same. So if you're like having forehead acne, that might be because you're using wrong hair products or you're having a lot of stress. With jawline and chin acne, especially, it indicates hormonal disbalance. So that is there when we go for hormonal tests and treatment is more of hormone based. Yeah, your forehead acne, chin acne, cheek acne might be because you're using some wrong product or your pillow is not clean or anything which is harming your face that can cause cheek acne. Depending on the site, the type of acne we can actually make out.
Right. And what are the treatment options available for acne management, doctor?
Yeah, depending on the type of acne, like I've told, there are different treatment options. Like if you're into very early stage of inflammation of acne, your benzoyl peroxide works, your salicylic acid works. If you're having more of pus-filled acne, then we go for oral antibiotics also. And if it's more of hormonal-based acne, then hormonal therapy is where it works. And a lot of nodules, cysts, that is when we go for isotretinoin. Yeah, a lot of treatment options. These are medical management,
Doctor,
like lasers and peels, depending on
procedures.
yes.
Yes, yes. डॉक्टर जब एक्ने होता है वो जिनको ज्यादा होता है वो इस बात से एग्री करेंगे कि एक्ने मैनेजमेंट इज वन थिंग एंड पोस्ट एक्ने प्रेगनेंसी मार्क्स स्कार्स पेट्स को छोड़ के जाते हैं और वहां लगता है कि दाग हमेशा के लिए these scars are forever ever ever because it's so difficult to get rid of those scars. So my question to you is मान लीजिए छोटा एक्ने है अभी ग्रेड उसका ज्यादा बढ़ा नहीं है तब अगर हम एक डॉक्टर के पास जाए और एक और पेशेंट है जो एक्ने सिस्टिक हो गए बहुत बड़े हो गए पेनफुल है फर्स्ट है तब वो डॉक्टर के पास जाए आर देयर चांसेस कि जो पहली गया है पहले ही इनिशियल स्टेजेस में उसकी स्कारिंग कम होगी आर देयर चांसेस
Definitely, definitely is. Because when you come with nodules and cysts, which is like the last stage of acne, which we call grade 4 or the severe acne, very high chances your skin is going to scar because there's a lot of damage which has already been done. Even if we treat such cases, so your inflammation, nodules, cysts, painful nodules जो है वो सारा is going to settle down. But ultimately, yes, it can lead to scarring. The sooner you start, the better it is for your skin.
तो इसलिए बहुत जरूरी है कि जैसे ही हमें एक्ने हो रहा है हम सही जगह rather than going for home remedies going for buying what your relatives friends are saying go and consult a qualified dermat again doctor for scars and marks what treatment options do we have.
Okay, for marks especially, you have a lot of treatment options like your peels, your laser, light-based devices. You have microdermabrasion, you have microneedling. Then for your scars, you have lasers, microneedling, your radio frequency devices. Then you have your CO2. So yeah, it's more of laser-based treatment for your scars because that is when your skin has already the collagen has already formed, and you cannot reverse it back with medications or any peels. That is the situation when you go for lasers. And for the earlier pigmentation, you have light peels and all.
Now, these days, influencers also ask people to get, peels done at home. They'll tell them कि ये peel available है, get it done at home. Then we have parlors जहाँ पे training करते हैं कि वो peels कर सकते हैं. Then cracks, quackery is increasing day by day. We have clinics without doctors, but these treatments are there. And then we have proper doctors, dermats, qualified dermats to do these treatments. And again, because economics is also associated with it, पार्लर में जाके बहुत सस्ते में लगता है हो जाएगा, ये घर पे तो और भी कम कहीं जाना ही नहीं है. And again, people fall for it. मैं आपसे ये जानना चाहती हूँ डॉक्टर कि क्यों जरूरी है कि क्वालिफाइड डर्मैट से ही ये प्रोसीजर्स करवाए जाए और कहीं से नहीं.
Because the thing is, unless you have knowledge of it, you are going to just keep ट्रायलिंग है कि अच्छा लास्ट टाइम ये फील्ड से असर नहीं हुआ ये वाला ट्राई कर लेते हैं इससे नहीं हुआ ये वाला ट्राई कर लेते हैं एंड अल्टीमेटली यू गोइंग एंड chemical peels it looks very simple but actually it can cause a lot of damage. I've seen patients coming with facial burns, having permanent scarring, having a lot of pigmentation. Again, it took a long time to recover. I've seen patients in के brush के marks रह गए like on the face because they've applied peel at home with brush and the skin has burnt wherever they have applied. So it is not so simple जितना लगता है. It's not like just a liquid which you apply. You actually need to have your knowledge. You actually need to have कि कौन सी लगानी है, कितने time तक लगानी है. बार बार मतलब अगर लगानी है तो कौन से सेशंस में कितने दिन में रिपीट करनी है, इसका प्रिकॉशंस, व्हाट आर द प्रिकॉशंस टू बी फॉलोड, एंड पोस्ट प्रोसीजर मैनेजमेंट क्या होता है, प्री प्रोसीजर प्राइमिंग क्या होता है. अनलेस यू हैव दिस नॉलेज, इट इज ऑल गोइंग टू बी ट्रायल एंड एरर. कि लगा दिया, अच्छा बर्न हो गया, अब तो डॉक्टर को दिखाना पड़ेगा. So why burn your, wait till your skin gets damaged and burn it and then go to the doctor. Very risky, I feel very very risky.
राइट, सो इवेंचुअली डॉक्टर के पास तो जाना ही पड़ेगा. इसलिए अच्छा है कि जब चीजें कंट्रोल में है, कम है, तभी अगर हम डॉक्टर के पास चले जाएंगे तो वो ट्रीटमेंट का लेंथ भी बहुत लेंथ नहीं होगा, कम रहेगा. एक ही प्रॉब्लम है वो डॉक्टर एड्रेस कर लेंगे, लेकिन बहुत सारे ट्रायल एंड एरर्स के बाद कॉम्प्लिकेशन बढ़ सकता है. और ऐसे भी कोई और ऑर्गन होगा, किडनी में प्रॉब्लम है, हार्ट में प्रॉब्लम है, देन वी गो एंड सीक एडवाइस फ्रॉम द राइट पर्सन, व्हिच इज दी the specialist, चाहे वो कार्डियोलॉजिस्ट हो इन केस ऑफ हार्ट, इन केस ऑफ किडनी कैन बी ए नेफ्रोलॉजिस्ट. तो हम तो वहां जाते हैं तो स्किन को लेके हम इतने लीवियंट क्यों हो जाते हैं, उसके लिए हमें सोचना चाहिए. Now, again, because so there are so many questions. रीना का क्वेश्चन है, कैन acne be mistaken for other skin conditions?
Yeah, definitely, definitely. I have seen patients having actually skin allergies, having skin reactions, other skin diseases, जिसको वो पिंपल समझ के they're like waiting कि अच्छा this will settle down, this will settle down, eventually causing a lot of last moment damage and all. So yes, acne can be mistaken with a lot of other skin diseases. It's not as simple as it sounds.
Right. And plus, diagnosis is equally important. Understanding the root cause is equally important. So even if you think it's an acne, please go and take an advice from your doctor. At least when diagnosed कि अंदर बॉडी में तो सब कुछ ठीक है ना, कोई प्रॉब्लम तो नहीं है, कोई अंडरलाइन डिजीज तो नहीं है, वो भी रूल आउट हो जाता है. Pratika का क्वेश्चन है, again a home remedy related question. Can honey be used to treat acne?
You can try, if it works, it works. I don't think so it works.
राइट, लेकिन गारंटी नहीं है. और हो सकता है हनी लगाते लगाते जो वो इनिशियल स्टेज पे था, धीरे धीरे वो बहुत ज्यादा ग्रो कर जाए, और जब तक आप डॉक्टर के पास पहुंचे वो बहुत ज्यादा बड़ा हो जाए, स्पैलिंग के चांसेस ज्यादा हो जाए. अच्छा, एक और बहुत कॉमन एक क्वेश्चन भी है आर्यन का, इज एक्ने ओनली अ टीनेज प्रॉब्लम?
And no, like I told early, like the first statement which I made, right from your puberty, your teenage age से लेके 30-40 तक भी you can get acne. It's not a teenage.
And females these days, due to so many hormonal changes and PCOD, PCOS, they are coming after so much of adult acne these days. अब टीनेज वाले प्यूबर्टी अटेन करने पे जो एक्ने वाला एक पूरा एक्ने वल्गरिस का जो फेस करता है, उस पे मेरा एक सवाल हो जाता है, व्हाट हैपेंस? So as a teenager, I'll talk to my parents, or my friends. पेरेंट्स का ये स्टेटमेंट होता है कि ये तो नेचुरल है, जो कि है, ये तो होगा ही. And it is a good sign that yeah, you are growing, hormones are building in your body, which is a good thing. तो डॉक्टर के पास जाने की जरूरत नहीं, eventually they will go away.
Yes.
लेकिन कई बार टीनेज में जब हम ध्यान नहीं देते तो स्कार्स रह जाते हैं. तो what would you like to suggest to all the parents or teenagers or young adolescents who are watching this segment?
Yeah, so see, things are not like before. पहले जैसे more of इतना people were not conscious about anything. They used to be like, हाँ ठीक है, ठीक हो जाएगा अपने आप, दाग भी छोड़ता है तो क्या है. Nowadays we are more professional. Everyone wants to, have the best skin possible. So I feel taking it very lightly and waiting for it to scar and then going the longer route, it's always better to start treatment early. It's not like सिर्फ scar ही छोड़ेगा. Earlier, अगर if you have teenage acne, sometimes it goes to such a stage where you get a lot of inflammation, you cannot talk, पूरा face is swollen, and you can get infection, fever हो जाता है ऐसे situation में. Try to wait for it to worsen till you start your treatment. Better to start your treatment early. Even in your teenage age होता है, but if you maintain your skin the right way, maintain your body the right way, because they'll take care of it. ऐसा नहीं है कि होगा ही हर किसी को.
Right. फीवर भी होता ही है, सबको होता है, it's a body's mechanism. But then when we have fever or it exceeds a certain level, we do go and consult a doctor. And in case there is a necessity, we get the test done. To take pimples as that only. ठीक है, naturally अच्छी बात है, we are growing, but then we need to go and consult the doctor. Jiva का question है, do probiotics have any impact on acne?
Probiotics have an impact on your skin health overall. So basically, acne mein there's a bacteria which causes your acne, which invades your skin. So in that situation, probiotics help in maintaining your skin barrier and normal skin environment. कि acne na ho. But active treat acne mein there are much other things like many other things which work rather than just taking probiotics at home. I think it's more of an adjuvant treatment rather than the main course treatment for acne. Adjuvant, yes, definitely. Probiotic creams आती है, moisturizers आते हैं, probiotic oral medications आती है which you can take from any chemist. But that is alongside your main treatment, not the main treatment.
Right. Doctor, many times it's a necessity for people to go for makeup. Many times it's their choice. Now, in case they have acne, can they go for makeup, especially air hostess, anchors, actors, they have these breakouts and plus they need to do makeup. क्या करें?
देखो प्रोफेशन है आई डोंट थिंक आई कैन लाइक इट्स राइट टू टेल देम नॉट टू apply any makeup but when you're applying your makeup at least when you're having your active breakouts and you're having active painful acne on your face avoid your mineral based makeup something which is जिसमें लिखा है very heavy coverage you know stays for longer time and very oil based makeup whatever you're doing oil based heavy coverage makeup and mineral based makeup ये makeup you avoid go for a कम coverage वाला भी चलेगा for temporary but कम coverage lighter makeup rather than concealing it and using a very heavy thicker foundation or anything that can again clog your pores.
एंड मेकअप रिमूव करना कितना जरूरी है? सुनते तो बहुत है, बिफोर गोइंग बेड डू रिमूव योर मेकअप, बट देन वी फील कि चलो यार 2 घंटे तो रहा है और 2 घंटे और रह जाएगा, क्या होगा? आपको काउंसिल क्या लगती है?
Yes, yes. No, it's very important. Again, but for removing, always go for a very mild cleanser, not anything which is harmful. ऐसा ना हो कि you're applying something and scrubbing your face to remove all the makeup. Very mild cleanser for your makeup. No oil-based cleanser, just a water-based cleanser.
And with makeup, the applicators, the sponge, brush, puff, we have so makeup products तो हम खरीदते रहते हैं, लेकिन एप्लीकेटर पे ध्यान नहीं देते कि वो हम साफ कर रहे हैं या नहीं कर रहे हैं. How important it is to clean our brushes on a regular basis, clean our sponge, etc. और क्या करना चाहिए?
Like I told again, bacterial infection है. The more dirtier it is, the more you're not cleaning it. We always tell our patients कि बार बार हाथ नहीं लगाओ फेस पे. You're again continuously checking कि acne एक नया आया है, एक आया है, पुराना सूखा है. Again your hands are very dirty. Again you're causing more of infection. Same thing happens with your brush. You're very least bothered कि वही लगा लेते हैं, वही यूज कर लेते हैं, उसमें कलर है. But then कितना infection है और उससे कितना breakout हो रहा है पता नहीं चलता. So always clean. Keep your brushes clean. Keep your sponges clean.
Right.
Yeah.
So maintaining good hygiene level, maintaining good personal hygiene is equally important. Take care of your brushes, your applicators, your sponge, and take care of your, whatever you are using, your pillowcases, your mobile phones, mobile cameras, etc. Doctor, before we wind up, any last message that you would like to tell before we conclude the session?
Yeah. I would want to tell the same thing which I started with simplicity and consistency. The more consistent you are, the better your skin is going to be. And never compare कि उन्होंने ये लगा लिया I'll try the same thing with your acne. Because it's not like it's कि something which is going to work for your friend or something which is going to work for some influencer online. it's going to work for you. Everyone's skin is different, everyone's skin journey is different. So always consult a dermatologist. They are the best ones who are going to assess your skin because they know the knowledge, they know the physiology behind it, they know the whole science behind it, rather than just applying some cream which has worked for her might not work for you, might not work for you. So yeah, always consult your dermatologist, and the more simpler and consistent you are, your skin is going to be fine.
Thank you so very much, Dr. Priyanka. It was wonderful talking to you. Thank you for joining us and thank you for this very informative session.
Thank you so much. Thank you for having me. It was lovely.
Thank you, Doctor. And viewers, thank you for your active participation. Stay happy, stay healthy, and take good care of yourself. Goodbye.
Bye.